I would like to thank the organizers for having me in this very interesting session. My name is Nittaya Phanuphak, and I'm working at the Institute of HIV Research and Innovation, or IHRI, in Bangkok. Today, I'm going to share with you our experience doing the community-led delivery of PrEP for men who have sex with men and transgender people in Thailand. Our key population-led PrEP service delivery model is well known as the Princess PrEP program. It is a free same-day PrEP service where PrEP is dispensed by key population-led providers. The main support to run this program mainly has come from public donation to Princess Somsawari Prevention Fund, which was transformed from the PMTCT Fund, established more than 25 years ago by our princess. Who was just recently appointed the UN's Goodwill Ambassador for HIV Prevention in Asia Pacific. In the Princess PrEP service program, the KP-led providers provide PrEP counseling and then provide HIV and STI testing, and then they dispense PrEP based on the standing order and remote approval by doctors. They also provide all these services in PrEP follow-up visits. The Princess PrEP program is part of the Key Population-Led Health Services, or KPLHS, and in Thailand, we define KPLHS as a set of services designed by key populations, and therefore they are needs-based, demand-driven, and client-centered. These services are delivered by trained and qualified lay providers who are mostly members of the key populations. The Princess PrEP program has contributed the largest PrEP dataset shown in blue here to the country and has moved PrEP into the coverage under the Thailand Universal Health Coverage Program in October last year. However, the fund for PrEP under UHC during this first year, coupled with the country's unreadiness to fund KPLHS, mean that the Princess PrEP program will likely need to continue for the next few years. The figure shown here also demonstrated that over more than 5 years of PrEP implementation in our country, we have now just reached 9% of the total PrEP target, calculated based on the number of key populations who are at high risk of getting HIV. In 2018, KPLHS has contributed to 55% of HIV testing among key populations, and in this case, mainly they were MSM and transgender women. The KPLHS also contributed to 55% of PrEP users in that year, which led to the legalization of KPLHS in 2019. Through the announcement of MOPH regulations, which allow KP-led providers to provide rapid or point-of-care testing for HIV and STIs, as well as to dispense PrEP, PEP, ART, and oral STI treatment. Looking at the building block of the Princess PrEP service, we can see that before COVID-19 pandemic, the screening and initiation of PrEP happened on the same day in KP-led clinics by KP-led providers with remote prescription from doctors. Only HIV and syphilis test results were available before PrEP was dispensed, while the clients will receive their creatinine and other lab test results a few days later. Initial follow-up happened at month 1 and month 3, and then every 3 months thereafter using the same building block, and syphilis and creatinine testing happened every 6 months. During COVID-19, the Princess PrEP service has continued with certain adaptations. Our KP-led providers in these KP-led clinics were not prioritized during PPE shortages, neither by our own government nor by their international funders. Therefore, the protective plastic shields and various types of protective box, panel, or frame had to be created by these lay providers themselves. Telehealth, along with PrEP drug delivery, was rapidly set up. Together with express services aiming at the shortest time spent in the clinic just for sample collection, while all the test results for HIV and STIs would be delivered to the clients via online platforms, has become very popular suddenly among our clients and providers. STI self-sampling also has shown to be very feasible among our MSM and transgender women clients over these times. The PrEP effective use concept was also introduced to our MSM clients in order to empower them to be able to tailor their PrEP use according to their risks, especially during the first few months that we experience low PrEP stock and unstable supply chain. So after COVID, practices that will likely become the new normal additions to the building block of Princess PrEP service include telehealth and PrEP drug delivery with potentially longer period for PrEP refill. It will also include express service and self-sampling for HIV and STI testing and PrEP effective use counseling. So in summary, it has been very, very obvious that the key population-led health services designed and co-delivered by key populations has increased significantly HIV test service uptake among MSM and transgender women over the past 5 years. In our country, the KP-led free same-day PrEP service is the main delivery model to scale up PrEP. And although KP-led providers are now legalized to dispense PrEP in KP-led clinics in our country, the service still could not be reimbursed, and there are much more advocacy work and activities to do. And lastly, longer than 3 months scripting, telehealth, express service, self-sampling, and PrEP effective use counseling will likely become the new normal. I'd like to end by acknowledging all Thai people who are the main funder of this Princess PrEP program, as well as other funders and implementers. Thank you very much for listening to this talk.